a revolutionary treatment is helping some patients feel relief from chronic pain.
My journey with chronic pain started about 15 years ago. It got very bad to where even clothing against my skin sometimes would trigger it. I was involved in a car accident, and somewhere through all of that, I developed a hernia, and when the surgeon went in to repair the hernia, I suffered nerve damage in my left groin. Eventually it went down behind my knee and even down into my foot.
When I first met Cam, you could see the despair in her eyes when she saw me, since she had gone through so many treatment options even before reaching me. It gave me a great feeling of reward to know that I was going to be able to offer her DRG stimulation, or what's known as dorsal root ganglion stimulation. Dorsal root ganglion stimulation is a way of stimulating a single nerve to actually treat that focal pain condition. DRG stimulation has allowed us to significantly increase our success rates to far better than anything we've seen or any other treatment option that is available, especially for pain in the lower limbs, for what we call CRPS, or complex regional pain syndrome.
I have tried numerous different methods of trying to control the pain, and it got to a point to where my doctor recommended that the best thing for me to do at that point was to try to stay down as much as I could in order to avoid aggravating the pain. The day I got my permanent implant done was a very exciting day. I was being cautiously optimistic, but I was still very excited and looking forward to the outcome.
Cam was actually a great candidate for DRG stimulation because she had a very focal pain pattern.
The stimulator can target a specific area in that lower body where you have a chronic pain, and it can help to relieve that pain. When I went to St. Luke's, from the receptionist through all of the staff in the office and Dr. Falowski himself, everybody was very kind, considerate, and concerned about what was going on with me.
Here at St. Luke's, we offer all the latest therapies in the treatment of chronic pain as well as CRPS, and we have access to the latest technologies, most of the time actually even before other institutions have it. We stay on the cutting edge with these therapies, and we're actually do a large volume of them and have a very low rates of any side effects or adverse events from them.
Now that I have the DRG therapy, I can now go out to dinner with my husband. We can go dancing if we want to, and actually we have done that once so far. I wish we would have had it for me 10 years ago, but I'm very thankful that I have it now. My attitude and my outlook on life has changed quite a bit since I've had this implant. Now that my pain is so much better controlled, I can enjoy playing with my grandchildren. I can take them to the park. I can take them for walks. I know now I can look forward to my future.
Joining us in the studio is Dr. Scott Loev, Director of Pain Medicine at St. Luke's University Health Network. Thank you for being here, Dr. Loev.
Thank you.
What is CRPS?
So CRPS stands for Chronic Regional Pain Syndrome. It's a chronic pain syndrome that is characterized by regional pain in an unusual distribution and not a normal distribution. And the pain is usually out of proportion to what normal pain would be after an injury or trauma. So for instance, if someone had surgery, normal time would pass, they'd have some pain initially, and then the pain would go away. Well, this is where the pain does not go away, and the pain lasts and becomes more severe.
And we hear another term, DRG. What exactly is that?
Sure, so DRG stands for dorsal root ganglion. The reason that we're discussing it is there's new technology out there where we place electronic leads around these sensory nerves that can help reduce or eliminate the pain from chronic regional pain syndrome, or CRPS.
You've got some really exciting stories to tell. I mean, you've got to really every day say, wow, I was able to get rid of his or her pain. It's got to make you feel, inside really terrific.
It's amazing. It's amazing, you know, to see the patient where they've been living with this pain, and right after the procedure, they cry. I mean, it's unbelievable. They've had such relief after this pain for so long, which they did not believe was possible.
When is it time to say to yourself, you know, I'm suffering, I'm in pain, and when is it time to say enough is enough and speak to someone like yourself?
I think once someone has been to the primary care physician, once they've been through the usual treatments, whether it's pain medications, over-the-counter medications, physical therapy, their pain persists, I think that's when it's time to be referred to a pain medicine physician.
Dr. Loev, how is patient care managed by a team of physicians at St. Luke's?
Well, at St. Luke's, we communicate directly with each other. We have a very close relationship, and we have a coordinator that allows the patient to come through and, if need be, to direct that patient throughout the network.
And that's a real key, communication and a bunch of eyes just following that patient's personal care.
Yeah, and I believe there's also a special relationship that we have at St. Luke's with among the pain physician, neurosurgeons, physical therapy, et cetera. And I mean, we literally will walk a patient over to the neurosurgeon or physical therapy and talk to them.
And we were talking about some of the stories. People are doing things now, whether it's back playing football with the grandkids or out on the golf course or whatever they love to do, that they're doing it now that they never thought they would ever be able to do that again.
Not only that, I mean, that's an excellent point. They're also allowed to do the things that normal people take advantage of. They can go back to work. They can play with their kids. They can come off of the pain medicines. And that's what's great about this. You know, the issue with opioids and the problems that are occurring, we can wean them or take them off their pain medications because they don't need that with this new technology. There's only about 200 physicians in the country that are performing this. St. Luke's is one of them. It's a regional center of excellence for what's called neuromodulation, or spinal cord stimulation, dorsal root ganglion stimulation.
And you've got to be very proud of that.
I'm very proud of that. I'm very proud of that. We have great physicians, great communications with the surgeons that we deal with, and a great system that is very much patient first and puts them throughout the network.
Dr. Loev, thank you so very, very much for being here. And,
thank you.
Keep up the great work and really making a difference in people's lives.
Thank you.
For more information on pain medicine or anything on today's show, go to our website, thepeaktv.com. Have a great week. Thanks so much for watching, and remember, every day is your chance to be your best self. This is The Peak. Hi, it's Mike Mittman from The Peak TV. Thanks so much for watching. Don't forget, subscribe and give us a thumbs up to see more videos.